I'd like to introduce Dr. Bernadette Melnyk. She is the University Chief Wellness Officer and leads all of our efforts in Buckeye Wellness. Bern, thank you so much for coming today.
Thank you. I'm delighted to join all of you today. And I wanted to start your day with a greeting from my pug, Honeydew Melon. This is the one group that is finding so many silver linings to this pandemic because they get to be at home with so many people who are working from home. So I try to start every morning with a smile and counting my blessings for what I have. So I want to start by thanking each and every one of you for everything you are doing during this very unsettling and historic pandemic. This was a special report that was released by Everyday Health about 2 years ago, before this pandemic hit. It was a national survey that showed people across the United States are under the most stress that they have ever experienced. The generation that showed the most stress in this national study was actually Generation Z. Those are people between 4 and 24 years of age. Then in 2017, the National Academy of Medicine said more than 50% of the physicians, nurses, and other healthcare providers are experiencing high levels of burnout that's not only affecting their mental and physical health, but it's also affecting quality of care and patient outcomes. So the National Academy of Medicine in 2017 launched the Action Collaborative on Clinician Wellbeing and Resilience. If you are not plugged in to this Action Collaborative, I'd really suggest that you get on the email listserv. There are 60 of us, and I feel very blessed to represent Ohio State on this Action Collaborative. We are working furiously with healthcare systems, with the C-suite, to really make improvements in system issues. Clinicians have a tendency to take good care, great care of everybody else, but we often don't prioritize our own self-care. And that's what I'm going to talk about today, for the most part, is how can we get a little time every day to really focus on our own self-care. That said, there are so many system issues contributing to burnout, stress, depression, even suicide in physicians and nurses, which is why the National Academy of Medicine Action Collaborative has reached out to the C-suite across the country to make them aware of these issues, to make a plea to focus on the well-being of your clinicians and to overcome barriers that we know are causing them distress. This pandemic is a great example, not having enough PPE. So 20% of clinicians of the cases that are positive right now are clinicians. We must step up our systems and do more to help our clinicians. So in the fall, if you haven't seen this NAM consensus study entitled Taking Action Against Clinician Burnout, a Systems Approach to Professional Well-Being, I recommend you take a good look at it. It has 6 major recommendations for systems to improve the well-being of clinicians. So the Melnyk Burnout Inventory is probably the best, valid, and reliable instrument to measure burnout in clinicians. But there is one valid item that's in the public domain that is highly correlated with the full scale. And I like to show this because I think it's important for us to be aware of our level of burnout. If you answer this one item as number 3, number 4, or number 5, I really encourage you to go and seek out some resources that can help you. There is no shame with us as clinicians being able to say, we're depressed, we're burnt out, and we need help. We encourage our people, our patients to do that. But oftentimes we still feel we should be strong. We shouldn't be the people that need to go and seek help, but we need to. When you look at suicide rates being the highest ever for physicians and nurses, we have got to put more emphasis on these problems. We've got to create wellness cultures so that the well-being of the people who care for so many can be focused on and improved. So the National Academy of Medicine's Action Collaborative published 2 case studies this past year, places that were really supportive and doing a lot for wellness for their clinicians, their faculty, and students. We were fortunate to have Ohio State featured as the only university and academic medical center that is a lead example of trying to do our best to support the well-being of our people. So even before COVID-19 happened, 1 out of 5 children, teens, adults were suffering from a mental health problem, yet less than 25% were getting treatment, particularly evidence-based treatment. Now, put COVID-19 on top of those are already substantial issues. We are going to see a tsunami of mental health issues coming as a result of this pandemic and its aftermath. This pandemic is triggering feelings of despair, fear for loss of loved ones. In our own state, this past week, a family lost 3 of their own family members, with the 4th in intensive care on a ventilator. Decreases in job security is huge right now. People are really scared. So many millions have lost their jobs. Distancing results in loneliness. And I really want to encourage us to talk about physical distancing, not social distancing, because our social relationships now and maintaining them are going to be so important for the mental health of people. There's also this mindset right now of we just got to survive. We just got to get through this. And I want us to look at this as, how can we look at this as a window of opportunity to build resiliency and coping skills in people so they will be more prepared to deal with life stressors as this pandemic ends. This pandemic is also creating a stress and anxiety pandemic all throughout the United States. When people feel a loss of control in one big way, such as COVID-19, they're looking for other ways to gain control back in their lives. So that first week in particular, there were mad rushes to the grocery store. You couldn't find toilet paper, paper towel, and other types of food products. As I mentioned when I introduced my little pug, Honeydew Melon, to all of you, this is a group that's really seeing the silver lining of this epidemic. But we also have to acknowledge all the evidence that we have that show us pets can really help enhance our mental and physical well-being. So all of us respond to stress in different ways. Many of us, our fight system kicks in when we're under stress. Flight kicks in for many of us. Somatic symptoms are a way that stress often manifests in us, with headache, even chest pain, abdominal pain. So recognizing these responses in ourselves early and the triggers that cause them are really important so we can kick in coping strategies to manage them better. As I mentioned before, if you begin to experience stress, anxiety, depressive, burnout symptoms to the point they begin interfering with your ability to concentrate or other types of functioning, please don't hesitate to ask for help. I just spoke this past November to 160 university presidents. They asked me to come and talk because presidents were calling the Association of Public and Land Grant Universities like crazy, asking for help. They say, We're hiring mental health counselors like crazy, but that's not helping. We're seeing mental health issues escalate. What do we do about this situation? So when I went to speak to this group of presidents, I really emphasized, our paradigm has been crisis intervention, and we need to switch from crisis intervention to prevention and early intervention. And there are evidence-based programs and tools that we can be using as preventive and early interventions. We're always going to need counselors, always. We're always going to need crisis intervention. But again, we've got to shift the paradigm and place much more emphasis on prevention and early intervention. So don't hesitate to ask for help. Contact our employee assistance program or other resources in our community. We just completed, as part of our work with the National Academy of Medicine Action Collaborative, a very rigorous, systematic review of evidence on what works to improve the mental health, well-being, physical health, and lifestyle behaviors in physicians and nurses. This was just accepted for publication in the American Journal of Health Promotion. We ended up including 29 intervention studies with 2,700 physicians and nurses. We found mindfulness works. Being here now, back to the present moment, is a really effective strategy. The issue with why a lot of hospitals are not implementing these types of programs, like our Mindfulness in Motion program, is many of these mindfulness programs are very lengthy, and they don't feel people really have the time to go through the preparation. However, there are simple techniques that we can do to bring us back to the present moment. One of the most effective, short, brief interventions for mindfulness and to cut the vagal stress response is deep breathing. 5 deep breaths. I know it sounds simple, but there's a lot of good studies that show if people can get into the habit of taking 5 slow, deep breaths several times a day, it really helps. So what I'd like us all to do now, at the bottom right of this slide is a diagram that expands and contracts. I'd like us to pause now and take 5 big, deep breaths. As you breathe in through your nose, I want you to say to yourself, I am calm. As you breathe out, I want you to say to yourself, I'm blowing all stress out. So let's take just a few seconds to take 5 big, deep breaths and sync it with this diagram. Again, abdominal breathing so helps. So please try and get into the habit of doing this regularly throughout your day and suggesting that your patients also do it. Well, we also found in this systematic review, daily gratitude practices really help lessen stress, anxiety, and depression. I'm showing you on this slide the wellness innovators in CCTS created a gratitude board, and people come in every day and they write what they're grateful for on the gratitude board. Evidence shows this can really help. I encourage you, get up in the morning, write down 3 things that you're grateful for today. Even if you have to look hard to find those things, we can find 3 people, 3 things we're grateful for. Cognitive behavior therapy works. It's the best evidence-based treatment for stress, anxiety, and depression, but so few people get it. Even people don't know to ask for it when they see a therapist. I've spent the last 25 years of my career developing and testing manualized CBT-based interventions. Through 17 studies, I've shown this manualized intervention drops depression, anxiety, stress, improves healthy lifestyle behaviors. 2 years ago, I worked out an agreement with Ohio State to freely gift this program for non-exclusive use to Ohio State so that our students, our faculty and staff could benefit from it. If you're interested in going through it, it's 7 weekly sessions that are about 40 minutes long. Starting the week of April 13th, we will have 10 sessions running of this MindStrong program. You can email mindstrong@osu.edu if you're interested in going through it. The other thing we showed through this systematic review, when clinicians had health coaches, they ate more healthy and balanced diets, they engaged in regular physical activity, and they minimized stress. We have 7 health coaches in our health plan who do a really good job. So maybe now's a great time to reach out to one of those health coaches and say, I could use your help with stress reduction for the next 6 weeks or so. And then we found just visual triggers placed where we can see them every day helps trigger healthy behaviors. So in CBT, we teach people how you think directly relates to how you feel and how you behave. By the time a child is 8 years of age, they've developed their thinking pattern. If it's a negative thinking pattern, they're going to grow up and experience more stress, depression, and anxiety. One of the reasons we have so much relapse, about 70% of people with major depressive disorder relapse even after treatment because they haven't changed their pattern of thinking. So again, it's super important to learn CBT skills, to teach them to our patients. In this program, we teach people, monitor your thinking, because we have so many automatic thoughts, we don't monitor our thinking anymore. But I encourage you, maybe take the next 24 hours, monitor activating events that are triggering a negative belief. Stop the negative belief, replace it with a positive thought to feel better. A classic example, we're being flooded during this pandemic with all the negative. And so you pick up the news, you go to the internet, you read how many deaths occurred in the last 24 hours. It's a major activator. And then you start to say, oh my gosh, what happens if I get this? I'm probably gonna die or end up in the ICU. So that's the time we need to stop those negative beliefs and say, this percent of people, the majority, recover fully from COVID-19. So again, monitoring for these activating events that trigger a negative belief or thought, stopping the negative belief and turning it around is a super helpful key strategy in CBT. So now I'd like you to think back to a recent time, this week maybe, when you felt angry, depressed, stressed, anxious, and I want you to think about what was your trigger. We often can't control triggers, but sometimes we can, like turning off the news 24/7. So what was your automatic thought? How did you feel? How did you behave? And how could you have turned that around to feel better? So the next time you are experiencing a change in your mood, I want you to stop and say to yourself, what was just going through my mind? Chances are it was a negative thought. But if you can get into the habit of monitoring for those negative thoughts, turning them around, I guarantee you, you're going to feel emotionally better. For a while, if you tend to be a negative pattern thinker, put a rubber band on your wrist as a cue. And when you have an activator followed by a negative thought, snap that rubber band to get you in the habit of picking up those negative thoughts and turning them around. People need help problem solving these days. So many parents, so many kids really have not been taught this 4-step problem solving process of what's the problem, what are the causes of the problem, then writing down what are the 2 to 3 solutions and not ruminating over those for days, but pick the best solution and act on it. Just going through this 4-step problem solving process to action can really help reduce stress and anxiety. Our brain is like a computer. What we put into it every day is what comes out. So again, if we're feeding our brains negative, we're gonna feel stressed out, anxious, and depressed. If we put positive in every day, we're going to feel better because more positives going to come out. One simple thing, because it does rewire our brains to the positive, is to practice saying 10 positive things every morning and every night. So just 10 times when we get up. What I like to do first thing in the morning is say to myself, I'm grateful, I'm healthy, I'm blessed that I can talk to you all this morning. I have my health, my husband is healthy, my 3 daughters are healthy, although one was exposed to COVID yesterday. But I'm of the mindset, again, the far majority of people who get infected, they're going to fully recover. So pick a statement, 1 or 2, 10 times in the morning, 10 times at night. You do that pattern over and over again, 7 days, 14 days, 30 days. It really makes a big, big difference. Stay in the present moment. The 2 most absorbing negative emotions that we have, worry about the future, guilt about the past. So much energy goes into things that have already happened that we can't change, and worry about the future. And most times those worries don't come to fruition. So when you find yourself going into the future, feeling guilty about the past, bring yourself back to the present moment. Go for a brief 5-minute walk. Look at everything in your surroundings. Say to yourself, what am I seeing right now? What am I feeling right now? What am I hearing? What am I smelling? It really takes practice to get us back to the present moment. Unplug. During the day, you of all people, you are bombarded. You have so many responsibilities. You gotta unplug. Even if it's for 5 minutes, a couple times a day, to do a little mindfulness, to take a brisk walk, to do 3 minutes of jumping jacks, whatever it is. We've got to disconnect. And again, during this time of loneliness for so many people, we need to connect, whether it's through FaceTime, Skype, Zoom, whatever it is. We need to have virtual social gatherings to keep those social connections going. So one of the best ways you can reduce your stress and anxiety is to take care of yourself. Take time for what I call recovery time. Even little 3 minutes during the day where you go somewhere quiet. Like I said, you go take a brisk walk. Our patterns of eating when we're emotionally stressed or anxious get to be unhealthy. Emotional eating during stressful times is really common. I encourage all of us to think about this formula. 80% healthy foods, 20% want foods. I never tell people to count calories, things like that. Put as much vegetables as you can on your plate, lean meat. But again, don't deprive yourself of everything you love, because what you're going to do is crave it more. And I know it might seem like a panacea when I talk about sleep. And you might say, yes, Bern, but you don't know. The long shifts we're working right now. But sleep is so critical. And whatever you can do, even if it's short stints, to get restful sleep, do your best to do that. We know when we're deprived of sleep, cortisol kicks in. That has so many adverse effects, including decreasing our immune system. If you have trouble falling asleep, try your best to get some white noise, either through an app or a white noise machine. That can really help. And engage in physical activity. We have got to keep that up. It's not only good for our physical health, but for our mental health. So we know cardiac disease, #1 killer in America. But if we put into consideration all causes of death and disease in this country, it's really our behaviors that are the #1 killer. And that's really sad because 80% of chronic disease is totally preventable with just a few healthy lifestyle behaviors. Sitting is also killing us. It's so good to see families outside walking now with their children. If we sit 3 hours a day, that increases our cardiac risk by 30%. And if we sit 5 hours a day, whether we exercise or not, that's comparable to smoking 1.25 packs of cigarettes every day on our bodies. So bottom line is, sitting also drains our energy. So if we want more energy and sustain it throughout the day, we've got to move more and sit less. I didn't fabricate this slide. This is a real fitness facility in the state of California where people have the choice. They can walk the stairs or the escalator to go work out at the gym. A group of psychologists studied this, and what they learned was only 2 people a day chose to take the steps instead of the escalator. This is based on population health data of more than 1 million people. So if we just could get all of us and the people we care for to engage in physical activity, 30 minutes, 5 days a week, minimum of 5 fruits and veggies, don't smoke, and if you don't drink alcohol, don't start. But if you do 1 drink a day, if you're a woman, 2 a day, if you're a man. If we could get everybody just to do these 4 healthy lifestyle behaviors, we would cut chronic disease by these substantial numbers. So, bottom line, if we can engage and get people to do these things, we will experience a lot less chronic disease. Everybody asked me on the alcohol question, how big can that drink of alcohol be? And I tell everybody, not the size of the alcoholic beverages we get in Vegas. Alcohol sales are climbing now. During this pandemic, people are going to use alcohol to self-regulate. So again, we have to help them cope in healthier ways. So I want you to think about today, being January 1. For the next 30 days, what can you do just a little bit differently to reduce your stress? Eat a little healthier, maybe get in a little bit more physical activity. The number one reason people don't take good time for self-care is because they say they don't have time. But I want to show you this video so you think about the time you have and how that time gets prioritized.
These are roughly 28,835 jelly beans. I counted out 500 of them and used those to weigh the rest. In this pile, there's one jelly bean for each day that the average American will live. You might have more beans in your life, or maybe less, but on average, this is the time we have. Here's a single bean. It's your very first day, a special day, but kind of a rough day on everyone involved. Add 364 more and you have the first year of your life. Now, for a sense of scale, here are your first 15 years, 5,475 days, which brings us to the threshold of adulthood. And at that moment, this is the time that we have left. And this is, on average, what we will do with all that time. We will be asleep for a total of 8,477 days. If we're lucky, some of that time we'll be sleeping next to someone we love. We will be in the process of eating, drinking, or preparing food for 1,635 days. We'll be at work, hopefully doing something satisfying for the equivalent of 3,202 of those days. 1,099 days will be spent commuting or traveling from one place to another, maybe a little bit more if you live in LA. On average, we will watch television in one form or another for a total of 2,676 days. Household activities like chores and tending to our pets and shopping will take another 1,576. We will care for the needs and well-being of others, our friends and family, for 564 days. We'll spend 671 days bathing, grooming, and doing all other bathroom-related activities. And another 720 days will go to community activities like religious and civic duties, charities, and taking classes. After we remove all those beans, this is what remains. This is the time that we have left. Time for laughing, swimming, making art, going on hikes, text messages, reading, checking Facebook, playing softball, maybe even teaching yourself how to play the guitar. So what are you going to do with this time? How much of it do you think you've already used up? And if you only had half of it, what would you do differently? What about half of that? How much time have you already spent worrying instead of doing something that you love? What if you just had one more day? What are you going to do today?
I think that's a very powerful clip, because if we don't take even a little time now to take better self-care, we will have to make time for illness later. So these last slides really focus on other things that we can do to decrease our stress, anxiety, and depressive symptoms. If you haven't read the book, The Present, by this physician, Spencer Johnson, I'd really encourage you to do that. It's about a little boy who meets a wise older man. And that man talks to the little boy about the best present in the whole wide world. That little boy thinks it's a material present, searches his entire life to find that gift. As he grows older, though, he realizes the best gift he could ever receive was to learn to stay mindful in the present moment. So I take 5 minutes to read in a positive thinking book every morning, every night. It really serves as a protective mechanism because we tend to get bombarded with negativity throughout our day. And when you're feeling overwhelmed, I really encourage you, come back to the present, what's right in front of you, and take one bite of a 2-ton chocolate element or bundle of carrots at a time. I don't know if you're aware, but Headspace is now offering their app for free to healthcare providers. Our Virgin Pulse has Will, which is a wonderful app. There's daily 5-minute meditation sessions, mindfulness, guidance to help you with sleep. Take advantage of incorporating some of these stress management apps into your day. We partnered with Everyday Health this past year to do a national study of resilience. This link, you can go to the website to a valid and reliable scale to assess your own resiliency. What we found, which we know, people with more resiliency suffer less from mental health and physical health problems. So the profile of resilient people, they stay active and engaged. They kick in. They feel like they can do something when adversity happens, and they keep their perspective. These are the 9 resiliency skills that we can build. Resiliency can be built, even if we weren't born with many of these skills. So this is my formula for coping with COVID. We've got to focus on the things we can control, not the things we can't. We've got to open up and share our feelings. We got to practice daily stress reduction, including physical activity. We've got to engage in mindfulness, being here now, because worry is not going to help. We need to count our blessings daily, overturn our negative thoughts to positive, volunteer to help others, identify helpful supports and resources, and do our best to prevent the spread of the virus. In October, we will be holding our second biennial national summit on promoting well-being and resilience in healthcare providers. I'm hoping many of you will be able to attend. This is co-sponsored by NAM's Action Collaborative on Clinician Wellbeing. So I'm going to finish by telling you, my mom stroked out right in front of me when I was 15 years of age. She sneezed and blew a hemorrhagic stroke. You can imagine, I suffered with terrible post-traumatic stress disorder for quite some time. There was no help for me in my little rural town of Republic, Pennsylvania, near the West Virginia border. But what was really sad about my mom's story, she had a history of headaches for over a year. And my dad kept saying, go to the doctor, figure out what's wrong. Well, she saw her family physician 1 week before she died. She was diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. So if you ever wonder why I'm so passionate about wellness and prevention. It stems back to losing my mom at age 15, something that may very well have been prevented. I want you to think about your wild boars. Those are things that undermine your ability to focus on your self-care, to devote just a little time every day to your own self-care. This is a clip from Johnson & Johnson's Human Performance Institute Corporate Athlete Program. It's a 2-day workshop that's focused on energy management. We do it here at Ohio State. It's free to people. We have online sessions coming up. We call it Health Athlete. Anybody of you who could do it, I suggest you go through it. It's fantastic. But I'm going to finish with this clip. These are 4 big NFL football players that were going through this athlete program in Florida. And the psychologist who was teaching the workshop said, I'm going to give you a mission to accomplish. What I want you to do is I want you to run through the Florida woods about a mile. You're going to see a white fence. I want you to touch the white fence, turn around, and come back. These 4 NFL football players laughed. They said, are you kidding me? Do you know what we do to train for the NFL? Then the psychologist said, well, wait a minute. You could encounter both water moccasins and alligators on your run to the white fence. They laughed, and then the psychologist said, I am telling you, there's also wild boars. They're 300 to 400 pounds. They have these long, sharp tusks. You've got to be observant for these wild boars. Again, the football players laughed. Watch what happens as they near the white fence and somebody who's hidden in the bushes plays a wild boar hog sound. So, again, be aware of your wild boars, barriers, things that are there in your life that's going to try to pull you off of the mission to take better self-care. And if you don't do it for yourself, do it for the people who love you, who want you to be around a really long time. This is my beautiful family. When I don't feel like getting up in the morning and getting in some physical activity, I put these faces in front of me because I didn't have a mom to see me graduate from high school, college, go on, and have my 3 beautiful daughters, my 2 grandsons. So to end, I just want to say, let's maintain hope. Rainbows follow rain, and we are going to experience rainbows after this pandemic. Thank you.
Bern, thank you so much for speaking at our conference today. I really appreciate it.
You're welcome. Delighted to do it.
That was incredible. Thank you so much. Really wonderful.